Good morning friends, my name is Dr. Shobhit Gupta. I am a consultant plastic surgeon from Delhi, Karol, Bagh area. Today in this video, I would be explaining you in detail about what is the plane of breast implant. Actually, we receive a lot of queries and people are really confused between that where the breast implant is placed exactly. So like before explaining you in detail, I would like to explain you a bit of anatomy of breast in a short, so that I would be explaining you exactly that where the implant is placed. So then first of all, if this is the cross section of your breast, if this is your outside and if this is your inside. So like for example, there is skin outside. Over the skin, there is a nipple and areola on the skin. Below the skin, there is fatty tissue. And below the fatty tissue, there is a gland, which is your original gland. And this is your muscle. So like coming from outside to inside, there is a layer, like first there is skin. Below the skin there is fat, below the fat there is gland, and below the gland there is muscle. So like there are two main areas or two main planes of application of the implant. So like one is the below the gland and one is the below the muscle. So like first it is the below the gland. The below the gland means it is the subglandular. So it is the subglandular plane and this is the subpectoral plane. So like these are two main the areas of the breast implant placement. One is the subglandular and the other is the submuscular. So either we place the implant which is below the gland or we can place the implant below the muscle. And there are some other plane also which is called dual plane. Dual planes means that half the implant is below the gland and half the implant is below the muscle. So ultimately this is all decided on your examination. So like when you come for a consultation, so like we examine you properly which implant and like which plane is like best for you and which suits you absolutely. And actually there are some differences between the subglandular placement and like some pectoral or some muscular placement. The cosmetic appearance is different. The cleavage area is different, and like the upper pole fullness is like different. Upper pole like visibility is different between this subglandular and subpectoral. So it is basically decided on our consultation that which type and which plane of implant is needed for you. For further information, you can always log into our website, or you can just call us, or you can just WhatsApp us on below given number, and we would be really happy to help you. I hope I have answered your questions about like the implant placement. Thank you so much. Thank you.